is Susan Michaels-Strasser. I'm the Senior Director of Human Resources for Health at ICAP at Columbia University. Today, we are speaking with Fatu Kekula, a former nursing student and full-time mother of one and inventor of the trash bag method, an accessible way for people to protect themselves in an epidemic using widely available and affordable products. As a young nursing student in Liberia during the 2014 to 2016 Ebola outbreak, Fatu improvised personal protective equipment, which allowed her to provide at-home care for 4 family members without becoming ill herself. And I distinctly remember the day that I read about her and about her inventiveness, her stick-to-itiveness, her ability to actively problem solve amidst crisis. And to me, those are the values and the attributes of nursing that I am most proud of. As hospitals were overwhelmed, Fatu quarantined her sick family members in a makeshift isolation room, an unfinished room outside of the family's home. She started IV lines to administer drugs she purchased from a local pharmacy and treated each patient with oral rehydration therapy. Several times a day, she placed trash bags over her socks, tying them off at the calf. She would then put on rubber boots, over which she added another layer of trash bags. She also wrapped her hair in a trash bag. When in close proximity to her ill relatives, she wore a raincoat, a surgical mask, and 4 gloves on each hand. After each visit to the isolation room, she would carefully remove her gear and spray herself with chlorinated water. She would then burn the contaminated equipment. Fatu cared for her 4 relatives for almost a month before space became available at a local hospital. One of her patients, her cousin, ultimately succumbed to the disease. Her mother, her father, and her sister all recovered. It's incredible. While Fatu hasn't yet completed nursing school, she has much to teach all of us as we grapple with how to respond to the ongoing COVID-19 crisis, particularly in communities around the world without access to the latest medical technologies, who have been particularly hard hit by global shortages of personal protective equipment and other medications necessary to help treat COVID-19. Her resiliency and her problem solving in the face of the most deadly outbreak of Ebola in modern history showcase the spirit of nursing and healthcare in small communities around the world. Fatu, I'm humbled. Thank you for joining us today. It's amazing what you did. You truly have saved lives. And in that, you have inspired us to remember, as Florence Nightingale did, some of the most basic things that we have can be life-saving: safe water, good ventilation. And this year, in the Year of the Nurse, I think you embody that, and you showed us as the world what practical basic things can do to not only safeguard you, but allow you to safely provide care and keep most of your family alive. It's incredible. I would like to ask you my first question. Now, here living in the United States, what makes you jump out of bed in the morning?
First thing in the morning, before I jump out of my bed, I first thank my Creator for creating me the ability to breathe, because many don't have the opportunity for that each and every day. And also, I jump out of bed because I'm a person with passion in order to prepare for what I have planned or what I have viewed for my future.
Great. Thank you. And I think your faith is clearly evident in your ability to overcome hardships and do what many would think was the impossible. Could you tell me what drew you to the nursing field initially?
Well, I got really interested into the nursing profession because my mom she worked as a nurse aide, and my dad is also an administrator with a health facility too. And I see the way my mom care for her patients, that she worked with the malnutritional unit. And each time, sometimes we go at the facility, take food to my mom. I see how she would care for these little kids who are very malnourished. Some of their parents don't even have anything. I remember someday my mom would bring these kids born over at our house, provide for them food, provide for them shelter. She will go beyond her her duty as a nurse. So she will shelter these people, and some of these mothers will be pregnant at the time, and they have a baby who is sick. So some of them will say, I guess Victoria, I'm going to name my baby after you. So my mom have a whole lot of music about how yeah, how she care for these mother and their kids. Yeah, so seeing her like that, it rather draw me because I'm a person who love to help people. I don't like to see people suffering. So I thought within myself, I think this would be a very good thing, since with the passion that I have, I'm going to be able to help people in this way. So that's how I really got uh, interested into the nursing profession.
You really grew up in it, and your mother definitely embodied those principles and those the ethos of nursing, even bringing in food for people. You really made me smile when you said, to have a lot of babies named after her. I
Yes.
worked for many years in Africa as a nurse. I lived in Africa for 14 years, and there's a lot of babies named Susan in the countries where I've worked, which is not a typical name. So it's just such a sign of respect and a thank you for what nurses do. And clearly your mother had a deep impact on your life. So when your family became sick in 2014, can you tell me a little bit about how that unfolded? What happened?
So in 2014, I was a nursing student at the time at Cottington University. I was in my third year at the university when Ebola struck. So at the time, I was away from Kakata. So this day, my mom called me on the phone and said that, oh, your dad is sick. So I asked her what happened, because at the time the rumor was going around of the virus. So she explained all of the symptoms to me. And then I told her, I said, but then you have to put it in a separate room. Yeah, because all of these symptoms that you are explaining to me now on the phone, it sound like, you know, it have all of those signs is like Ebola. So that's how she separated him in his separate room. And then I came over from where I was. When I came, because she didn't quarantine him when I was not away. I told her to quarantine him when she called me. And Ben and they were sleeping together on the same bed and, sharing everything. So it was during that time that she got sick, and my sister too. Both of them were helping, not using like the protection. They felt that it was just ordinary ailment. So that's how they both got the virus. And then when I came over, my mom, she was still okay at that time. She was not sick yet. After a few days, and then she got sick. My sister got sick, and my little cousin too. All of them got sick. So we tried taking them at the unit, but at the time, everything was so overwhelmed at the hospital. Nurses were dying, doctors were dying, so all of the hospital got shut down. So I had no option to create my own unit at home, separate all of them in separate rooms. and started to care for them by giving them IV fluids, hydrating them, and I was just treating them based on their symptoms they were presenting because we know at the time Ebola they didn't have treatment.
Right.
So I was just treating each of them based on the symptoms that they had until a facility got uh, um, ready. That was after 21 days. I treated a couple of them at home
Wow.
alone. Yeah, after 21 days, and then there was a facility, and they were taking out the facility. But unfortunately, my cousin didn't survive the virus. But my mom, dad, and sister, they all survived, and they are all doing okay now.
Incredible. I mean, you were like the sole hospital for your family, and you were everything, the doctor, the nurse, the pharmacist. I mean, how did you keep going? What helped you to keep going?
At the time, I was just getting medication from nearby hospital pharmacy, and then I was in communication with our family doctor too. He was on the phone telling me what to do. Each time I get stuck, and I would call him, and he would give me some medication, some procedure to follow, and that's what I just
You used your resources, the people that you knew, and were also incredibly resourceful, you know, creating an isolation place for them, but also being able to protect yourself. And I really was taken by just thinking about, you must have worked night and day, because I know with Ebola, one of the key things is keeping people hydrated. And, you know, when you put up an IV line, you have to monitor it, and you have to provide care to keep people clean, and you have to, you know, help them to drink fluids. And you must have just been working all the time over those 21 days. You were very resourceful, and I know that one of the key components of helping people with Ebola we now is keeping them hydrated. And you were everything. You were the pharmacy, you were the doctor, you were the nurse. And how did you keep going and keeping them all hydrated and alive? You must have been working all the time.
Yes, I was working all the time. As I said, that was a very, very stressful moment.
Mhm.
But then I had a one goal set in mind, which kept me pushing. That was to try and keep my family alive. So
Yeah.
then I think on that, it just gave me more power and more courage to do what I was doing for them.
I was talking to a nurse yesterday who worked in Queens, part of New York City, yesterday, and she remarked about how people during crisis, what she found is how people came together. People who may not necessarily come together came together and were all working as one during the COVID-19 pandemic here in New York, when it was at its height. Are there parallels or commonalities that you see between Ebola and COVID-19?
Yes, there are so many. Because look, both diseases, they are very like contagious, and like with Ebola in Liberia at the time when we had the outbreak procedure, we had people in the community who were going from house to house, door to door, and trying to make awareness to people. And also, I think one of the things that helped us to contain the virus was the facility of the ETU, the Ebola Treatment Unit, where they have Ebola patients being quarantined, and then the regular hospital was left for people who didn't have Ebola but they were sick. So that really helped the country to get rid of Ebola faster.
Yes, you remind me that, what was used in Liberia are these basic principles that we know work in public health, such as quarantine. Why do you think what are we struggling with here in the US? We now have over 200,000 cases and we have these amazing hospitals, but we still are really struggling. What do you think, when you look at your experience in Liberia and here, what do you think, what is going on here that you see as different?
In Liberia, we didn't just look up to health workers because the community have a very huge impact to contribute in any disease. So even like the student nurse, I think the US can use those people. And I think one of the things that the US was to do is to create a facility separate for COVID-19 patients, because I've seen or heard people who have the virus, they are being sent home in order to quarantine at home. So I don't think that is really safe. And with that measure in place, I think the virus will continue to go on and on and on, because this is a virus that is very contagious. So I think there should be a specific unit where each and everyone who have the virus can be quarantined, and then once you get okay, you can be sent back home. So I think that's one of the things I see very different from the US handling this virus.
Yeah, I think in the US we're very used to our individual freedom but I completely hear you. We do know that isolation and quarantine make a difference and they do help to stop epidemics or pandemics. And I'm working on the contact tracing program here and in New York City, and it's not uncommon for family members, to like in your case, they all become positive because it's very hard with such a highly infectious virus. I think there is a lot we can learn from other countries. We do see that the numbers are remaining comparatively low in West Africa, where you're from, and other parts of Africa. What brings you hope in addressing COVID-19? What makes you hopeful that we'll get through this?
I'm hopeful that um, that we, the citizens, can, because the health workers are working extremely tirelessly in order to help this virus go away. And I'm hopeful that citizens will abide by all of the rules and regulations that have been given by the CDC and other health experts. Now we can follow these procedures, follow these regulations in order to help this virus to go away. So that's what I'm
Yeah,
hoping for. That
thank
is by
you.
wearing our masks, washing our hands, trying to stay social distance, and all of those things, because we all have a part to play in this virus. We all do.
There's so much wisdom in what you just said, and it's so true that the health workers are working tirelessly. And like you described in Liberia, people going door to door to spread the message about Ebola. The citizens of our country are central to the response. And if we all wear masks and socially distance and wash our hands regularly, we would be in a different situation. Just like you showed with very simple products and IV fluids, you kept your family alive, and it can be done. And you showed that it can be done despite a lot of barriers in our way. And it takes hard work and it takes the citizens coming together. Thank you for that. Lastly, as we conclude, again, I want to thank you for being with us today, and I look forward to staying in contact with you. My last question is, how can nurses and nursing students best respond to the current pandemic and push the concept of health and public health in our communities?
Well, first of all, I must thank the nurses because they are already doing their very best in responding to this pandemic. And I think in order for nurses to be able to respond adequately to this pandemic, they need to be provided the rightful materials, like such as the personal protective equipment used. And I Well, first of all, I must thank the nurses because they are already doing their very best in responding to this pandemic. And I think in order for nurses to be able to respond adequately to this pandemic, they need to be provided the rightful materials, like such as the personal protective equipment used. And I think nurses need to be trained in how to respond to pandemic in case such pandemic broke up in the near future. Nurses, we need to have a nurses who are trained to handle that pandemic because I know nurses do care for people. They do care for sick patients, but I think nurses need to be really trained on how to handle pandemic in case it arises.
I completely agree. In fact, we are starting a new fellowship here at Columbia on pandemic preparedness, and we will definitely have nurses as part of this fellowship because it is all part of healthcare and protecting individuals and the public's life. I want to say thank you again. It's really a privilege and an honor. I'm humbled by your story and your resilience, and look forward to continuing to work with you as you move forward on your journey to become a nurse. And the nursing profession is lucky to have someone like you as a champion for healthcare and health, public health. And as I said at the beginning, you really embody so many of those things that Florence Nightingale was a champion of: basic public health, being there on the front lines, being practical, being results driven, using the knowledge that you had even as a third-year nursing student to save the life of 3 of your family members is just remarkable. So thank you so much for your time. And in this year of the nurse, thank you all for attending this session and for remembering the important role nurses play in safeguarding health of the public. And as we move forward into 2021, let us remember the words of Fatu that we need to work together. It takes all of us, all citizens, all health workers working together to create a society that thrives and is free of pandemics. Thank you.